Hello, my name is Marie Carmel Ellie. Welcome to our talk on palliative care. So today I'll be talking a little bit about the background of palliative care, what is palliative care, and how does palliative care help patients. So some end-of-life facts. About 86% of patients that are at the end of life prefer to spend as much time as possible in their home. 75% of patients would not choose a treatment if they thought that it was going to decrease their cognitive function. About 50% of patients greater than the age of 65 will have an emergency department visit within 1 month at the end of life. And of those patients, they'll be admitted to the ICU and experience a death. So while many people picture this at the end of life, comfort in their home, dying peacefully, in the 21st century, what we generally find is that patients have an encounter with an emergency department, an intensive care unit, and ultimately spend the rest of their days and die in a hospital setting. So what is palliative care? Palliative care is a specialty that is designed to provide care to patients that have serious or advanced illness. It can be provided to patients at any stage of their serious illness, and it's delivered by a specially trained team of physicians, nurses, and other specialists. Palliative care can be delivered in the inpatient or the outpatient setting, so it can be delivered in the hospital or in an assisted living facility, a skilled nursing facility, in a patient's home, or in the patient's provider office. So when thinking about palliative care, I'd like to direct your attention to the figure on the bottom of the slide. So at the beginning of the course of care for anyone that has advanced illness, there's always an attempt or an approach to attempting to reverse the illness or to cure the illness. And notice that even at the beginning of the illness, that palliative care can be introduced right away. But over the course of illness, as the disease progresses, you may find that curative care is not as much of an option. And so as the curative care diminishes, more palliative care is introduced. And at the point where curative care is no longer an option, and there's 100% palliative care, and there is concern that the patient is moving towards the end of life, hospice is introduced. So while hospice care is palliative, not all palliative care is actually hospice. Upon death, bereavement is introduced to the patient's caregivers. So while palliative care is often thought of as care for the elderly, it could also be introduced to children and to the pediatric population. In fact, palliative care can be delivered at any age. So how does palliative care actually help our patients? So while curative treatments may be provided at the same time, palliative care focuses on the relief from the symptoms of distress or illness rather than a focus on a cure of the underlying illness. So though a curative treatment may be delivered at the same time, palliative care can be delivered throughout the course of illness. So think of the treatment for a common cold or flu. Managing the discomforting symptoms with fever-reducing medication, decongestants, and fluids are all considered palliative. As there is not necessarily a cure, but the treatments aim to optimize comfort as the body deals with the underlying infection. Palliative care also addresses symptoms of distress that are not necessarily physical. And so managing emotional and spiritual distress is also part of palliative care. You can imagine that serious illness and the prospect of losing one's independence or dying is difficult. And so palliative care, in addition to managing physical symptoms, also manages the emotional, psychological, and spiritual distress that can be experienced by patients. Importantly, palliative care focuses on improving quality of life rather than the prognosis or the quantity of time that is left for the patient. This may involve medical trade-offs to achieve a personal goal. That goal may be awaiting the birth of a child or the attendance to a wedding. An example of a value trade-off would be a patient declining an additional course of chemotherapy. With the prospect of the chemotherapy prolonging life by 2 to 3 months, there's also known complications of nausea, vomiting, loss of appetite, risk of infections, compelling that individual to be physically isolated and socially distancing themselves. A patient may forego that additional course of chemotherapy in order to plan to spend a Thanksgiving dinner over a meal with family and friends. An important feature of palliative care is a focus on the quality of life and the stress often experienced by caregivers. Palliative care clinicians often also provide guidance in making key decisions regarding health in the event a patient loses their capacity to make decisions. This is frequently a key service shown to improve the likelihood that a person's wishes are honored and also helps to relieve the burden of the caregiver having to make decisions at the end of life. Studies show that when palliative care specialist is involved with a patient's care, there is an association with decreased use of emergency rooms, decreased use of intensive care units, decreased social isolation, improved symptoms, decreased caregiver strain and quality of life, and increased sense of support by caregivers when a loved one has died. So in this presentation, we saw that palliative care is an additional layer of care and support that provides a comprehensive approach to patients and caregivers that bridges the gaps of communication that often exist between medical specialties. Palliative care aligns with the patients and loved ones to meet their needs and achieve their goals of care.